And we're back with Conversations on a Bench. I hope you've been watching and sharing this. We have a new YouTube channel, so I would ask you to please subscribe, and that'll build our viewers and just help us as you share it. So thank you for watching. And actually, now we have Scott Cleveland from Seattle's UGM. Um, what's your position there?
I'm Vice President of Program Ministries.
Okay.
Yeah.
Scott, tell me what does that mean?
Well, it
Tell
means I
people who
oversee
don't know.
all of our men's programs. So we have
Right.
one right around the corner from here. We operate multiple services from the one on 2nd in Washington.
Mm-hmm.
We have a dental clinic there. We provide legal services as well, it's wraparound services. We have overnight services as well as something that we refer to as the Enhanced Shelter now. And then we have a one-year residential recovery program. And we have a program for folks that don't have substance use issues, but they have financial barriers. So they've come to us because they've exhausted all their funds and they need to get realigned with employment. So it's a program called Link. And then we also have a Spanish-speaking Link program as well. So a lot of stuff going on right around
You
the
guys
corner
are doing
from
a
here.
lot over there. So it's Seattle's UGM, is that what you call it?
It's the
Union
Seattle's
Gospel?
Union Gospel Mission.
So I see them as our sister ministry. We're both part of Citygate Network, who is kind of the impetus for getting these conversations on a bench going. There are more than 300 missions across North America. And so we're both part of that association. We're independent. We have our own boards. We're separate ministries, but Citygate is a great help to us in Washington, D.C., and with conferences and training and support and so on. So
Absolutely.
we're related, right?
Absolutely.
But you guys have been around for how many years? A long time.
92 years this year.
Okay, so it started, I think we're like 86 now. So
Okay.
probably not too much difference in how old, but you guys are really covering a lot of different issues for sure. We focus on men and program for men. You guys are kind of hitting the spectrum. If you've seen the billboards or heard on the radio, it's them, it's not us. I have people all the time, oh, I heard you on the radio. No, you didn't.
Well, and
Not
it's
yet.
interesting. We exchange guests all the time, though. You know, so we're serving the same population for sure.
We are, and we're trying to learn who does what best, so that we can take certain people and you can, or if we can't help them anymore, we send them to you, vice versa.
Yeah, or we're just not duplicating services.
Yeah,
right?
exactly.
Yeah, for sure.
Exactly. So, although there's enough to go around, but we don't want to duplicate if we don't
absolutely.
have to. So Scott, tell me more about the enhanced shelter.
Yeah, super excited about this. Actually, in 2020, Dr. Robert Marbutt, who you know, formless homeless czar under the Trump administration, he came to visit the mission. He was actually supposed to speak to my boss, but my boss wasn't there that day, so we got about a 3-hour conversation with him. But in the midst of that conversation, COVID did one thing for us. It helped us slow down long enough to kind of really examine how we were doing services, and specifically overnight services. And I just started sharing with him. I'm like, I feel like we could do things better. And he goes, it's interesting, Scott, because he traveled across the nation and seen all the missions across the United States and Canada. And he said, people are thinking different. They're starting to actually get really curious about really this specific way that we're doing overnight services. And in a way, I kind of credit him for just allowing me to be creative, curious, and examine kind of different ways of doing overnight services. And I was talking to my boss about it. I'm like, gosh, I really feel like we could do better. And in some ways, I felt like, maybe we were doing a disservice. I realized that through COVID, like we had people that were staying with us for an awful long time.
Right.
And we're trying to do a transformational ministry here. And folks have been sticking around 2 and 3 years. I just thought we could do better. And then it wasn't long after that I actually got a call from somebody else that's in the ministry. And I said, I feel like we could do something better, possibly do like, maybe do some overnight services, but then, have a place for people to store their belongings and maybe do like, and get them off of a cot and get them into a bed and get them some case management.
Right.
And this gal said, Scott, you're talking about something called the Enhanced Shelter, and Seattle's starting to adopt this. I'd never heard the term before in my life. And I went, let me write that down, the Enhanced Shelter. And so, I really started getting curious about it. And put pen to paper and wrote a proposal up, and we started the enhanced shelter right here at the bench shelter. And it just allows us to bring people off the street and help them really reduce barriers that keep them stuck in a cycle of homelessness. And get them off a cot and get them into a bed, get them some real help, some wraparound services.
Right.
So, yeah.
Right. I know that a few years ago you had a lot of just people on the street outside the mission, and that's not the way it is anymore. What did you guys do that changed that?
Well, I think the main thing we did is we stopped our external feeding program. We realized that folks are doing external feeding all around the neighborhood and even further out. And so we were kind of duplicating services. But the other
Right.
thing that we caught on to is, it's kind of an interesting phenomenon that takes place. You have your guests that are coming in to get a meal, but as soon as you get a certain number of guests that are coming in to have a lunch with you, you have another set of population that kind of they prey on that population, right?
Yes.
Have you ever noticed
Yes.
that? And they get their needs met through one another.
Right.
And that's really what we were starting to see. We're like, golly, this is not working well.
You guys are in an interesting spot too, because you've got Chief Seattle right nearby.
Yep.
And what else is near you?
DESC.
DESC.
Yep.
And
And we're right on the
there's
corner, like this little piece
housing.
of pie.
What is the housing across from you?
Oh, yeah, it's the hub.
It's
hub
like
housing.
permanent supportive housing, right?
Right.
So there's a lot of people in that general area that can be preyed upon.
That's exactly right.
Yeah, and so there's a lot of drug dealing down there and so on that does not help you with what you're doing,
Not one bit.
right?
And actually, the population that we're trying to serve is, folks that are experiencing homelessness.
Right.
And what we noticed we were doing is we were serving a lot of people who were on subsidized income.
Right.
And so tons of them. We were serving over 1,000 meals a day. I'm like, is that really our target audience?
Right.
Because we're trying to get people off the street, into program, help them get, reduce barriers that keep them stuck in a cycle of homelessness. It's like, golly, we're kind of doing a disservice here.
Right. I lost my train of thought there. Where are those people eating now? Are they going hungry? You're not
at
feeding them
all.
anymore, right?
Not at all. I mean, one thing about Seattle, I always say we don't have a problem with services. We have a problem with relationships.
Yes.
Right? We're a ministry. This is one thing that me and you have really in common. Like, we believe that, people are fundamentally hurt in the context of relationship, but they're also healed in the context of relationship, right? And so we want to get them into our programs and get their mental health addressed, get those deep wounds addressed, and start, realigning themselves with really God, community, and themselves.
Yes.
It's exactly what you do here.
Exactly.
That's the exact formula that we use.
And there are lots of other places that are feeding people in
Oh
Seattle.
my gosh, yes. I mean, within a rock's throw.
Yeah. We did exactly the same thing. When I came here, we only had 6 people on staff for 140 beds. Like, yeah.
How do you do it?
I don't know. And 3 of those were admin and development. So there were 3 people running the shelter. And we were doing 3 meals a day to the public, and we were doing a day room. And people were just sitting around in the day room doing nothing all day. And to me, that is hurting people as much as helping. Like,
Thank you.
yeah,
Thank you.
I've read, there's 2 books around that topic. One is When Helping Hurts.
Yep.
It talks more about missions and so on, but it does, like, missions overseas, but also what we do. And there's another one called Toxic Charity.
Yep.
And I went through that one with my board,
Yep.
and we talked about what are we doing that is really helping people, and is it possible that some of what we're doing is hurting them, but it feels good to us?
Exactly.
And that's huge. Like, how many people go out and want to feed people or do something because it feels good for them, whether it's good for those people or not?
Yeah, in fact, really honestly, it can oftentimes keep people stuck.
Yeah.
And stuck in a cycle of homelessness. That's why I don't give out money for folks that have signs, right? I just don't do that. Now, I definitely want to get to know people's names. I want to care for people,
Right.
love on people, share resources, things like that. Maybe do a candy bar or something like that. I definitely don't want to keep somebody stuck on the side of a sidewalk.
Right.
And we were seeing the same thing too. I mean, we had 177 guests every night with 2 staff. So what really happens in that context is the guests actually are running things, right? And
Yeah.
our guests are broken, they're hurting,
And culture
they're
does not
caught up.
happen.
Yeah. So it's all
Culture.
bad,
Yeah.
right?
Yeah.
So anyway, yeah, that's the enhanced shelter in a nutshell.
Yeah, that's great. Yeah, we also stopped doing the public feeding, other than holidays. You
Yeah,
know, we want to
exactly.
help people on holidays, but they're getting meals elsewhere, and it's helping us to put our time and energy into people who really are homeless and who really want life change.
Praise God.
Yeah, yeah. So tell me about the co-occurring program. I'm really interested to hear more about this.
Probably unique.
We've got to come visit.
Yeah, you do. I'd love
Yeah.
to get you up there. It's on Capitol Hill. It's probably unique to anything that we're doing in the nation right now. It's a 1-year residential program. Of course, our programs are free, but we provide mental health services there. We have our own mental health counselors and our own substance use disorder professionals as well. And so we recognize that people who have experienced homelessness, 99% of those folks have also experienced trauma.
Wow.
And so have mental health issues as well. I mean, they're just so intertwined.
Yeah.
And so we wanted to meet that need. So we have a 34-bed facility on Capitol Hill. Used to be an old Carmelite monastery, so it's a very stately building. It's not what you would expect out of a mission, so it's really cool looking. And of course, 1 year, we know that people don't get messed up overnight. It takes a while to actually realign folks with God, community, and with employment, those types of things. So, we're taking the long haul at it, and we're seeing some pretty good success.
That's great. One of the things that we talk about in fundraising for missions is that people really want to give to feeding programs, right? They'll give to that all day long, but when we talk about like a program where we're helping people move forward, it's like crickets. They don't really give.
I don't think they get it.
I don't think so. And it's easier, I think, to think I'm going to feed them and it'll make me feel better. But what's really going to make a difference in the city and in people's lives is all the supportive services that cost so much more than a meal. This must be a really expensive program because you guys have professionals on staff.
Yeah, we do. And I mean, we've been really blessed. I mean, the Seattle Junior Gospel Mission has been around 92 years. I feel like the community has bought into the vision. Of course, we have an amazing fundraising team. And, we just bring a heightened awareness to what we're doing. Lots of tours. I mean, folks can see it every day. I mean, it's hard to walk from one part of Seattle to the next without seeing folks that have substance abuse issues, mental health issues, experiencing homelessness. So we like to bring that to the forefront. And I feel like we have been around a long time. We have a good reputation, as you do, and folks are willing to give to help their community out. But it's not. You have to bring it to them.
Right.
You have to
we
make them
talk
aware
about
of it. You have to talk about it. You have to show them what you're doing.
Right.
And I think people want to see results also.
Yeah.
So
Yeah,
I mean,
they do.
That's part of the
and
puzzle.
it's a really hard thing to quantify.
Yes.
But we're really working in this industry to have measurable outcomes so that we can actually say, yes, we're doing this work, and we're seeing great outcomes from it.
Of course.
But it is hard to measure. So
Well, and I mean, what's success for one person may not be success for
Right.
another, right? So even in the enhanced shelter, if we can get people on meds, get them stabilized, get them employment, like we see that as great success.
Right.
Right? If we can get them into our long-term recovery program, we see that as success too, or realign with their family. There's different ways of measuring success.
Right.
But we do see great success of people coming through our long-term residential recovery programs.
That's
We're
great.
following them 2 years after they've left program. We have an aftercare program, so we maintain relationship with them. I mean, I think there used to be a time where you get people into a program, they would graduate, and we'd all say, yay, well done. But it's really not enough.
It's not the end.
It's not the end.
It's the
almost,
beginning.
It's the beginning.
It's like
right?
it's like, when I was young, I used to think high school graduation was it.
Yeah.
Right? No, that's the beginning.
Yep.
That's just putting me where I can, go to college and get a career and have a family And that's like our graduations. It's
Of course.
really just the beginning of a brand new life for them, and they still need somebody to walk with
They
them.
still need a lot of care.
Yeah,
Yeah.
yeah. Scott, how did you get involved at Seattle's Union Gospel
Yeah,
Mission?
thanks for asking. So in 1999, my brother and I were actually living in the Mojave Desert. We were both experiencing homelessness. We were both strung out on
Really?
drugs. And my brother got really sick, went into the hospital, and went into a coma. And
Wow.
they contacted my parents and said, you need to come down and, your son is in a coma. If he comes out of it, they didn't even know if he would. They didn't know what shape he would be in. So they came down to actually see Bob. They were prepared to see him, but they were not prepared to see me. And I think I weighed 100 pounds at the time, and had a big abscess on my side. And my mom had been a nurse all her life. She got me into the hospital as well. And I remember waking up in that intensive care unit, small hospital in the high desert hospital, and the smell of the room and the heart monitor, and I mean all that stuff is as fresh on me today as it was 25 years ago. But
Wow.
I thought it was the end of the road for us, really. The last story, the last chapter, right?
Yeah.
But it's really where my story begins. It's
Yes.
like that's when some doors opened up where me and Bob got to come to the Union Gospel Mission and realign ourselves with the Lord honestly. Like I felt like that was the biggest breakthrough for me. I knew the Lord before, but I drifted so far away from Him. But I felt like God really had a calling on my life, and just got to get, had people around me that believed in me, could see stuff in me I couldn't see in myself. Was able to go back to school and, just really start a new life.
I had no idea. Like, you just shocked me. I didn't know that was your backstory.
Yeah.
So, wow, that's great.
Yeah.
And tell me, what does it help you bring to the job that you wouldn't have if you had never had that in your life?
I think I just have a level of compassion that maybe not everybody has. Like I get that, people it's a moment in time in a way, right? Experiencing homelessness is like, it doesn't define you. And there's hope.
Yeah.
By golly, there's hope. And I think that's something that I can bring to the table that not everybody gets.
Right.
Like it doesn't matter where you are or your walk or your history or all of that. It's just, man, there's a pathway back,
Yeah.
and there's hope. And I feel like, I can see it in people that maybe they can't see in themselves.
I think that's so important. It's so easy to think that, like, kind of the people that we see, they're invisible. But if we realize that they are somebody's son, they're somebody's father or uncle or sister or mother, and it puts a whole different spin on it, right? You were somebody's son.
That's right.
And she didn't know where you were, I assume.
Of course.
And how important was it to reestablish that relationship with your family in your recovery?
Statistically, people that can reconnect with their family just do way better than people that don't have family. And so my family was my biggest cheerleader, for sure.
Yeah.
And I think it was paramount to getting me through the first 6 months, right? Those are those tough times.
Yeah.
Change is difficult, man. I always tell everybody, this is how tough change is. Fold your arms the way you always do, and then do it backwards, right? It's like you always hesitate. And that's just folding your arms like, this is how I always sit, and this is backwards. Like it's like, change is tough.
It doesn't feel right.
It doesn't feel right. It's a pathway. It takes time. It takes resilience, all of those things that you have to just put in place. So,
right.
Yeah.
So Discovery Institute, I talked to Steve Burai a little while ago, and one of the things they're saying in their latest report is that we do need to help people get back home.
Sure.
Sometimes, and it's not we're going to throw them on a bus, give them a bus ticket, and you're out of here, but more that it's important to help people get close to their family if they're healthy.
If they're healthy, I think that's totally
healthy.
key. Thank you.
That's so key.
Thanks, Kim.
But maybe get them to a mission near where they have family, so that family can come around them and help them, instead of just leaving them here. And then when they leave our mission, they may have no support.
Exactly.
How do you feel about that?
Well, I think you hit the nail on the head. I mean, I feel like, if you have a healthy family unit, right, that you can send people back to,
Right.
it's a catch-22. Because
Right.
sometimes we're doing all the work with folks in the mission, getting them realigned with the Lord and, with community and a job and all that kind of stuff, and they'll go back home, so to speak. And if the things aren't healthy there, I've heard people say, I liked you better when you were using, right? If the
Oh,
family
yeah.
dynamics are messed up.
Yeah.
So, but if the family dynamics are healthy, I agree with that
Yeah.
100%.
And I
You bet.
100% agree that if they're not healthy, that's not the place
It's
for
not going to
them.
work for them.
Yeah.
Yeah.
Yeah. Anything else you want to share today? Talk about?
Hey, thanks for coming out and making people aware of what's happening here in Seattle. Thank you for the great work you're doing here.
Thank you.
You've done a really nice job in a short amount of time.
Thank
You're a
you.
rock star.
Thank you.
Yeah, thanks for having me.
Well, I'm really glad to have a sister up the street from us, and
Yeah.
we can work together more in the future. So thanks for being here today.